UK is recording, as we've been saying, one of the highest COVID-19 rates in the world, with nearly 50,000 new cases confirmed only yesterday. This is the highest figure since so-called Freedom Day and the end of lockdown back in July.
Meanwhile, a staggering 1 in 12 secondary school children are infected currently, and there are concerns that the booster jab rollout is simply moving too slowly. So, is it time to trigger the Plan B ahead of winter? Joining us to discuss this, Professor Devi Sridhar, Chair of Global Public Health at the University of Edinburgh. We're also joined by Professor of Oncology at St George's Hospital, Angus Dalgleish, Professor Adam Finn, who's a member of the Joint Committee on Vaccination and Immunisation, and the Financial Times' data specialist John Byrne-Murdoch. Good morning to all of you.
Morning.
Look, let's start with John Byrne-Murdoch, actually, at the Financial Times, because you do the number crunching on this. Tell us about how worried you are at the graphs, where we stand in terms of worldwide figures on infections, hospitalisations and deaths, and also just how we compare to countries, our neighbours in Europe, who already have the measures in place that we consider Plan B, which is masks and COVID passports.
Sure. I think, look, the first thing I want to say straight out of the gate here is that we're not talking about the UK being on the brink of a crisis. We're not talking about the UK being in an exceptionally bad situation. It's more that other countries with very similar contexts to us, similar sorts of countries to us, are doing better. And so whereas deaths in the UK are still only about 10% of what they were last winter, so a much better position, they are nonetheless 3 times the level that we're seeing in our peer countries like France, Spain, Italy and Germany. Similarly, hospital admissions are well down from where they were at the worst of the pandemic, but are much higher than other countries that are similar to us. And so why is
it worse here then? Why is it worse here than in other countries? I mean, you put it in context, you're right, you know, we're not at panic stations at the moment, but why do we have a much bigger problem here than, say, in France? What are we doing wrong?
I mean, I think you'll be surprised to hear that it's not a straightforward answer, but there are a few factors that seem to be playing a part. One is the fact that there is a lot more indoor mixing in large groups and crowded settings going on in the UK at the moment than in those other countries. Now, part of that is simply because the weather, as we well know, is not as nice here. It's colder, it's damper, there's obviously more of us spending time indoors. And there's also, in some countries at least, some slight differences in masking policy. But then there are other factors as well, such as this idea of waning immunity. So the longer the amount of time that has passed since someone has received their second dose, you start to see that slight drop-off in the amount of protection given by the vaccine. And the simple fact is because we were ahead of the curve in terms of vaccinations in this country, the efficacy of the vaccination is it's the first to run out, basically. So that's why we need the booster campaign upgrading. And we've heard this morning that it's going too slowly. Could we just bring in the Professor of Oncology at St George's Hospital, Angus Dalgleish, and to take a line from Dad's Army, Mr Dalgleish, in your view, it's a case of don't panic, isn't it?
Well, it basically is don't panic enough to start going back down the route that we did in the last year before Christmas and even contemplate anything like a lockdown. I think it is very important to adapt to the conditions. And so for people who are at risk or concerned to have the distance and to wear the masks in appropriate places, just in fact as they did in Sweden. Basically, they were left to their devices with very good advice, and I think that has worked no less badly than anywhere else. So that's my big concern is that we mustn't get anywhere near panicking and lockdown as we come up to winter. I mean, I've been working as on the coalface in medicine for years. And at this time, we always get running up to winter. We get the flu, the colds, all sorts of infections, people coming in with pneumonia. I mean, it is normal. You mustn't mix this new pandemic with normal. And we are going to get overloaded hospitals, etc., and overloaded infections. So we mustn't confiscate the freedoms, the movements that we've got now, just for the sake of a rising thing of this virus, which I think eventually, I mean, it is not as lethal as it was, and it's not causing the morbidity immunity that we've seen before due to the vaccination programme. So we mustn't forget that.
We do have an issue, though, don't we, Professor Adam Finn, because you're on the Joint Committee on Vaccination and Immunisation, with the fact that the immunity that the vaccines give us, that does start to decline after about 5 months. But people who are at 5 months, in many, many cases, are not going to get their booster jab for another 2 or 3 months. What is the problem with the booster programme? Why isn't everybody in those top categories being offered an immediate booster? Is it stocks or is it staff?
Well, I think it's a combination of things. I think the first thing to say about this is that the vaccines are actually not a tool that can be relied upon all by themselves to control spread of infection. So these vaccines are very good at stopping people from getting sick and ending up in hospital, but they're not so efficient at stopping people getting the infection altogether and passing it on to other people. They'll do it to some extent, but if we try to rely on the vaccine program on its own to keep things under control, we will see this problem getting worse.
No, you're right. We can't rely on it entirely, as we've seen. But what we have to do is make sure it's working at maximum capacity, don't we? Do you know why, in some cases, people won't get their boosters for months?
Well, I suspect the rollout of the boosters is mostly around the logistics of delivery. As you say, it's not that we're short of supply at the moment, and I don't think that the elderly people and the healthcare workers that are the first targets for boosters are in any way unwilling to come forward and receive them. No. So I think the rate limit step is delivery, yes.
I'm not particularly good with graphs, but I think I got the image from John Byrne-Murdoch's graph that we showed there, and it does seem to be that there is a correlation in the rise in cases in this country compared to other countries around the world, and our behaviour, that we're simply not wearing masks in the same way that we used to, and we're not socially distancing in the same way that we used to. And, I mean, I've just come back from France, and they are still wearing masks, and they are still socially distancing, and you have to show a vaccine passport if you go to a cafe or a restaurant or a bar or a nightclub or anything like that. So in this country, we seem to be sort of very relaxed about it. Do you think, let's go back to Professor Devi Sridhar now, Chair of Global Public Health at the University of Edinburgh. Professor, do you think that that's part of the problem, that we've simply just got a bit too relaxed about this?
Yes, definitely. I think there is a lot to learn from our European neighbours, France, Italy, Germany. And the things they're doing are not lockdown in the way that we had it in the past. It's masks in indoor spaces, public transport, shops. It is vaccine certification or a negative test result when you're going into mixing indoors, which we know is the most risky. And also they are pushing vaccination to a higher level than we have, especially in younger age groups. And so I think we do need to be looking at them and saying, what are they doing to keep their economy open, keep society open, keeping, the harms minimized, the non-COVID harms, but at the same time managing their COVID numbers as they go into winter. Because the NHS, if you talk to people working within it, in ICU units, staffing issues, they are struggling, and they struggle every winter. And this winter they have COVID on top of it. So I think we do need to be attentive to the limited health services capacity we have.
Who was that? Sorry, somebody was trying to get in. Was that Professor Dalgleish?
Yes, it was, yeah.
You're fine.
No, I had somebody ask me from the studio.
I'm terribly sorry. OK, but Professor Dalgleish, you do work in a hospital. And obviously you're very concerned about cancer, people getting treatment, people who may have left treatment over lockdown, things that weren't checked early enough, people not getting access to treatment. But what is the situation in the hospital with COVID cases still taking up too much time and energy and, all the emotional stress that puts staff under?
Well, it does put staff under incredible pressure, and everybody's aware of the potential for burnout that is going on amongst the staff. But as I've been campaigning right from the word go, we mustn't forget the reason we were there for all the other cases. We mustn't let the COVID destroy the normal service. And we're starting to see now, just as feared or predicted, a terrible litany of people who presenting with later cancer, who couldn't get screened early by their GPs. And we really have to address the whole system of general practice and how people...
Your personal thing on this is that you think that we should actually be doing a lot more testing for immunity on people before, for example, they have the booster jab. jab. Can you explain your thinking behind that?
Sorry, I missed
Yes.
that little...
I understand that you believe that we should be testing people for immunity, how their immune levels are, because they may have had the COVID infection and recovered from it, and that will have conferred immunity. They may have had 1 or 2 jabs, and that you believe that actually we should be testing for immunity before we move forward to give them the booster. Could you explain your thinking behind that, please?
Absolutely. Thank you very much. That's what I thought. There was a little drop in the sound there. But yes, I question the need to go and give everybody boosters when a lot of people have good immune responses, particularly the young. The young have very, very good T-cell responses if they've been exposed to the virus. And I question, do they need the boosting, or is it going to be a waste, or if anything, will it perturbate the very good response they've got? Also, there's people who've made very good responses to the vaccines. OK, they decay, but does that mean that they're not any less able to cope with the COVID? And it now looks like you can get COVID again, but you don't get the symptoms. Immune response. So what I'm saying is, rather than go around and boost everybody at just a big pan program, why not test them? And I've had discussions with other people who say, well, it's a hassle to do a test and it delays things. No, it's not. It's no hassle I mean, the number of PCR tests and things you have to do to go traveling and all the other tests that we've been had to put up with, it should not be difficult for one test to see what is your immune response to your last vaccine, or if you've had very bad COVID, have you got a good immune response, and do you need the booster?
Can I just ask you on a technical point, how long would it take to get the results of a test on your immunity? How long would you have to wait for?
I would expect about 2 days. Right. So I mean, it is something that you'd have to have a test. But if it stops you having the booster vaccine, you saved a vaccine, which may be completely useless for you. There is evidence that the boosters increase the number of antibodies, but there's big questions about the quality of those antibodies that are raised by the boosters. So I think it's at the time now.
Let's just pop that past a global public health expert, Professor Sridhar. Is that, I mean, testing for immunity, the way that Professor Dalgleish describes it, sounds like, you know, it would be a really useful thing for us all to know. Might save on vaccine doses as well and the delivery problems.
Yeah, I mean, I think all we can do is look at other countries and look what they're doing in terms of trying to preserve immunity. And the way they are trying to do that is through boosters. I'm looking at the United States closely. I'm looking at Israel, and they're not saying, in, for example, the United States, boosters for everyone. They're saying it for people who are most vulnerable, those over 60, in the UK, those over 50, people who, if we risk leaving them unvaccinated this winter, it's a big risk in terms of our hospitalizations and exposing people unnecessarily when we have these vaccines. And I do want to address that the biggest issue to global vaccine supply is not the UK vaccinating its own citizens or offering boosters. It's actually needing to manufacture and have regional hubs and emergency IP transfers so those factories can make it for Africa, for Latin America, for South Asia. And so in a way, us boosting is not like it's taking away from other parts of the world.
All right, thank you all very much. What I find fascinating about discussions with a range of people like this and a range of disciplines is how it reveals that we're still groping our way to understanding the virus. I mean, we're still not there yet, are we? We're still not clear on how it works.
Also, we were hoping the vaccine was going to be the magic bullet.
Not quite the magic bullet that we were praying for, but, you know, hey, a hell of a lot better than the alternative. We might still have been looking for a vaccine as we speak.
I can't see how we're not going to go back to masks, at least, in, you know, mandatory masks.
In the winter. Yeah.
In order to keep transmission levels
It's
low.
funny, I must be honest, I had stopped wearing mine a bit around, but yesterday and the day before I found myself putting it back on again. It just seemed to feel it doesn't cost anything, it's harmless, and we know it helps a bit, so why not? It takes the edge off.
Yeah. All
right, thank you all very much for your opinions. This, you know, it's just as I say, such an interesting subject that constantly changes and keeps just slipping slightly out of our reach, doesn't it? We think we got it, and then it slips away again.